Hi Cucumber colleagues, this is Nellie talking to you about my Fflearning topic for today, which is schizoaffective disorder. Schizoaffective disorder is an illness that involves the person experiencing both psychotic symptoms, so at least two psychotic symptoms, as well as mood disorder symptoms. So the person may experience psychosis and or mania or depression. Now, as we know, people with depression can experience psychotic symptoms. People with bipolar can experience psychotic symptoms. So what's the difference with schizoaffective disorder? Well, with schizoaffective disorder, the difference is really very much about what happens when. So although you have a combination of psychotic and mood disorders, for a diagnosis of schizoaffective disorder to be made, there needs to be a period of time where there is only psychotic symptoms, so that the psychotic symptoms do not occur in the presence of a mood disorder. So that means the person is not psychotic and depressed, or not psychotic and manic. They are just simply experiencing, usually for I think it's about a 2-week period of psychosis. So, if you're trying to think about trying to get your head around schizoaffective disorder, and it's quite a difficult diagnosis to make, you need a fair bit of collateral history, then you need to just keep in mind that if you imagine that Hadu here is psychosis, and Saji Saj is mood disorder. For a diagnosis of schizoaffective disorder, the person would need to have a history of mood disorder, and also of at least a 2-week period of only experiencing psychosis in the absence of any mood disorder. Now, with schizoaffective disorder, stop licking me. Schizoaffective disorder, more women are diagnosed with this disorder than men. Not too sure why, and diagnosis is generally about in the age of the early 20s. And there's not a lot of research into schizoaffective disorder because it's not an easily diagnosed illness. But there is some evidence that there is a genetic component to schizoaffective disorder. So just going back, just to quickly recap that schizoaffective disorder is an illness where the person experiences psychotic symptoms and mood symptoms, but there is at least some periods of time where there is only psychotic symptoms. I hope this has helped you to have a good understanding about, a bit of a better understanding about schizoaffective disorder. Thank you.